Morning, Dr. Walker from denwalker.com. Welcome back to the channel. I'll talk today a little about magnesium, specifically the one I would not take on a routine basis. So remember now, magnesium has so many benefits in the system, in the body. It helps with insulin control, diabetes control, blood sugar control, muscle relaxation, restless leg syndrome. Helps a lot with that. Sleeping disorders, helping you fall asleep and staying asleep. All of those things are benefit of magnesium. As a side note, though, let me say this really quick. People with restless leg syndrome, I think one of the things that magnesium does is helps with that, but also grounding. As I said before, grounding helps a lot with people with restless leg syndrome. I do take my magnesium later in the day, at night specifically, and I do take two types. I do take, in the morning I take threonate, in the evening I take glycinate. It's 400 milligrams for adult and about 320 for females, and it's the RDA based basis on that. So remember, the RDA talks specifically about the minimum amount of whatever it is for you to take. So magnesium, the minimum is 400 for male, but I do take 400 in the morning for myself with threonate, and then at night I take 200 milligrams of glycinate. Now, I talk with your doc about magnesium in terms of how much you're taking and so forth. A lot of folks will say get magnesium from your food. Yeah, but remember, the ground is depleted of a lot of the natural minerals, so you're not getting a whole lot from your food. But yes, there is some magnesium in certain foods, but I think supplementing that, just to be certain on the good side that you're getting enough. And again, one more thing: blood pressure issues, blood pressure controls. If you have blood pressure disorder and you're not taking magnesium, you are doing yourself a disservice. You're doing yourself a disservice. And 68% of us, people in general, are magnesium deficient. 68% of people, and I'm certain most people who have blood pressure disorders, their providers not telling them magnesium it's one of the few things, magnesium, that does vascular or arterial relaxation. Potassium is the other one that I know of, but magnesium helps to relax blood pressure, blood vessels, so it helps control your blood pressure. And that is so, I can't say that enough. But anyway, two I do not typically recommend, and the first one I'll talk about is citrate. Magnesium citrate, if you have constipation or chronic constipation, it's probably a decent one for you to take, but I do not recommend that one on a regular, because it just causes so much GI disorders, specifically diarrhea. It causes more diarrhea. But more importantly, I should say, the one I try to tell people, do not take this one. It should not be your 400 milligram one. It should not be your normal daily one unless you have chronic migraines. So chronic migraines, many have discussed magnesium oxide. Magnesium oxide is the one that helps a lot with that. So if you have headaches, chronic headaches, magnesium oxide at night, very, very well with that. It is still 400 milligrams. The problem again with magnesium oxide is that very little gets absorbed into your system. So only about 20% or so gets absorbed into your blood, which, unlike things like glycinate, which 80+ % of that one actually gets absorbed by the system. But magnesium oxide, though, it doesn't work so well. Now, you can get some GI discomfort, GI disorder with glycinate. Actually, with all magnesium, you can get some discomfort, belly pain and so forth. That's why I take it with a little bit of food. So I take mine towards the end of the day again, and if not, if it's too late to eat food, I'll drink with lots of water and so forth before going to bed. And it helps. It doesn't bother me as much, but I know with certain people, zinc is the other one, and magnesium is the other one that can actually give you some belly discomfort and belly ache and pain, and even nausea sometimes with some people can get with magnesium. So take it with food and so forth. Again, magnesium oxide is the one I would not take on a regular basis unless I have chronic headaches. And I'll put a list of the magnesium in the footnote here when I get a chance. But the other ones I think are reasonable. The main two ones that I do suggest to people are threonate and magnesium glycinate. And stay away, if you can, from oxide, definitely oxide. Stay away from that, and that should be well. Thanks for listening, Dr. Walker. Have a great day.